Last week, the Navy finally agreed to pay over $1.5 million to fund a study looking into the health effects of water contamination at Camp Lejeune, the Marine Corps base in North Carolina. The study could show a link between toxic water at the base and the illnesses and deaths of Marines and their family members for a 30-year period, from the late 50s to the late 80s. Thousands of Marines and their families who were stationed at Camp Lejeune have long complained of illnesses and deaths linked to exposure to toxic water. Health officials estimate 1 million people were exposed to contaminated well water at the base before the main well was shut down in 1984. But the Navy had refused to fund such a study for months, despite bipartisan demands from North Carolina politicians. Documents recently reviewed by the press reveal the contamination was far more extensive and deadly than previously assumed. They point to massive leaks of benzene, a known carcinogen, from a fuel storage farm at Camp Lejeune. They also suggest an environmental contractor dramatically underreported the level of benzene found in tap water in 1984, then omitted it altogether as the Marine base prepared for a federal health review a decade later. For more on the story, I'm joined in Washington, D.C. by Barbara Barrett, the Washington correspondent with McClatchy Newspapers, who's closely following the story. And joining us on the line from White Lake, North Carolina, is a former Marine, Jerome Ensminger. His daughter, Janie, was conceived when he was at Camp Lejeune. She died of leukemia in 1985. He's testified 3 times before Congress and is the co-founder of the site The Few, the Proud, the Forgotten. We welcome you both to Democracy Now! Barbara Barrett, lay out the story.
Well, essentially, as you mentioned, this has been going on for those former Marines and their families who lived on base from 1957 through 1987. There are some estimates that as many as 1 million people might have been exposed over that time. The contaminants include TCE, PCE, benzene, and vinyl chloride. For a long time, the Marines blamed this in part on a dry cleaner near the base and said that the main contaminants were TCE, trichloroethylene, and PCE, tetrachloroethylene. But McClatchy reported over a week ago that these new documents showed that as many as 800,000 gallons of benzene, which is a component of fuel, might have been spilled at this centrally located fuel farm on base over the course of, we're not entirely sure. There may be some estimates that it could be even more. We're trying to learn more, as are folks like Jerry Ensminger. But right now, this changes a lot of the science of what's going on. As you mentioned, the Navy agreed last week to finally fund this mortality study. It's about $1.5 million. It will compare the deaths of Marines based at Camp Lejeune to the deaths of Marines based at Camp Pendleton to see if they can track some sort of more definitive link between the contamination from Lejeune with the rest of those Marines who were not exposed at Camp Pendleton.
Where did this study come from? I mean, what kind of pressure has been applied on the Navy to agree to this study after how many decades?
Well, Camp Lejeune is listed as a Superfund site under the EPA because of the contamination, and they have been working on this cleanup. So that's been going on. Meanwhile, the Marines have been told to contact former Marines and their families who have lived there over the years. They have done some efforts with that. They've worked with the IRS to contact people. They've also put advertisements in magazines and newspapers trying to reach out to people. But really, the ATSDR, the Agency for Toxic Substances and Disease Registry, an arm of the CDC, has been responsible for years in trying to understand more definitively a scientific link between the contamination and a variety of cancers that family members have been reporting, along with other illnesses. There's a whole host of studies that ATSDR has been trying to do. One of the key studies is this mortality study, because scientists really believe it will help develop a more definitive link between the contamination and actual deaths that could be linked to that. There are, as you mentioned, lawmakers from North Carolina, excuse me, Senator Richard Burr, a Republican, and Senator Kay Hagan, a Democrat, who have been pushing hard for this study to happen. The newly revealed documents last week inspired Representative Brad Miller in the House. He's a Democrat from North Carolina and is the chairman of the Oversight Panel on the House Science Committee. He's called for an investigation into these documents and why they haven't been revealed earlier. As a matter of fact, the first that ATSDR really knew about the benzene came just over a year ago, they had put out a study a decade ago about the TCE and PCE contaminants and its possible link. A little over a year ago, they learned through the activism of some family members about the benzene link. They actually retracted that earlier study and are trying now to learn more about the benzene and its impact. Benzene is a known carcinogen.
Jerome Ensminger, can you tell us the story of your family? You were a former Marine stationed at Camp Lejeune.
Yes. Good morning, by the way.
It's great to have you with us.
My daughter Janie, as Barb had mentioned before or earlier, that she was the only one of my 4 children that was conceived while we lived at Camp Lejeune. Subsequently, Janie was diagnosed when she was 6 years old with acute lymphocytic leukemia. We watched her die a little bit at a time for nearly 2.5 years until that fateful day in September of 1985 when she finally passed away. Well, from the date of her diagnosis until a day in August of 1997, I always had this nagging question about why did this happen? Why did this happen to my daughter? Why did she have to go through this hell? And I never thought that I was ever going to get an answer to that nagging question. And one evening in August of 1997, I was walking in the living room from the kitchen with a plate of spaghetti to sit down and watch the evening news, and as I walked into the living room, the reporter on the television stated that ATSDR had completed their public health assessment for Camp Lejeune, and the chemicals that had been found in the drinking water, and they incorrectly stated from 1968 to 1985, were linked to childhood cancer, primarily leukemia. Well, I'm here to tell you I dropped my plate of spaghetti on the living room floor. And, you know, I got a glimmer of hope at that time that I may get an answer to that nagging question. And ever since that time, I have been active in getting all the rest of these people an answer to that nagging question that they may have. So, and I'd like to point out one thing, that the 1957 date through 1987 is for the Terra Terrace housing area only. That was determined through ATSDR's water modeling effort there. ATSDR is currently modeling the water systems at Hadnot Point, which is commonly referred to as Mainside, where most of the Marines